Hello, this is Dr. Doreste with the Cranial Release Technique. It's 10:35 Tuesday morning, the 28th of May, 2019. And I've been keeping an eye on our friend, the vagus nerve. And the vagus nerve is the 10th cranial nerve. And there is a lot of research happening with the vagus nerve. And this article comes from mentalfloss.com, and I will link this article down below. But I just wanted to read a little bit with you and go through a few concepts and connect some dots as to why the cranial release technique might be something you would look at if you're suffering with some sort of a vagal nerve issue. And let's, before you say, well, I don't even know what the vagal nerve is, so how can I have a vagal nerve issue? Well, let's just learn a little bit more about the vagus nerve. The vagus nerve is so named because it wanders like a vagabond, sending out sensory fibers from your brainstem to your visceral organs. The visceral organs, all the organs basically inside the chest and abdomen. The vagus nerve, which is the longest of the cranial nerves, controls your inner nerve center, the parasympathetic nervous system. So let's just stop there for a moment. We've discussed on other videos the concept of the automatic or autonomic nervous system, which is made of the sympathetic and the parasympathetic nervous system. So the sympathetic nervous system, for lack of a better explanation, if you can imagine driving a car, the sympathetic nervous system would be the accelerator or the gas pedal, and the parasympathetic would be the brake pedal. So you need both. The tendency, in my experience and the experience of many other practitioners, is the majority of our patients are stuck in the sympathetic side of the autonomic nervous system, the accelerator side. Rushing, stressing, running, never making time to calm down, always rush, rush, push, push, push. So back to our friend the vagus nerve. The vagus nerve is part of the parasympathetic nervous system. It's the calming side of the autonomic nervous system. If I just continue, it oversees a vast range of crucial functions, communicating motor and sensory impulses to every organ in your body. New research has revealed that it may also be the missing link to treating chronic inflammation and the beginning of an exciting new field of treatment for serious, incurable diseases. Here are 9 facts about this powerful nerve bundle. So I don't want to read the whole article. Again, I'll link it down below. But the first point is the vagus nerve prevents inflammation. And so that's a hot word right now. You're hearing inflammation all over. And again, if you were to hit yourself with a hammer or hit your finger would swell up. That would be inflammation. That's normal, that's natural, that's the body's way to prevent further damage and to help the healing process. The problem is, if we read down below here, a certain amount of inflammation after an injury or illness is normal, but an overabundance is linked to many diseases and conditions, from sepsis to the autoimmune condition rheumatoid arthritis. The vagus nerve operates a vast network of fibers stationed like spies all on your organs. When it gets a signal for inflammation, the presence of cytokines or a substance called tumor necrosis factor, or TNF, it alerts the brain and draws out anti-inflammatory neurotransmitters that regulate the body's immune response. So it's very important for what's called overall or systemic inflammation. Number 2, it helps you make memories. And again, I'm not going to read all this, but it talks about related studies were done in humans suggesting promising treatments for conditions like Alzheimer's disease by stimulation of the vagus nerve. It helps you breathe. It's intimately involved with your heart. Well, as a matter of fact, I want to just go back here for a moment because the vagus nerve is responsible for controlling the heart rate via the electrical impulses to specialized muscle tissue, the heart's natural pacemaker. In the right atrium, where acetylcholine release slows the pulse, by measuring the time between your individual heartbeats and then plotting this on a chart over time, doctors can determine your heart rate variability, or HRV. This data can offer clues about the resilience of your heart and your vagus nerve. So in cranial release technique, I have used the heart rate variability device on scores and scores. And within a minute after applying the cranial release, you will see the heart rate variability output change. And you will see, again, 90 plus patients that I would hook up to the heart rate variability would be in the sympathetic dominant state. And after the cranial release technique, you will check the heart rate variability, which is an objective test showing that now they are shifted and are functioning more in the parasympathetic side of the nervous system, which means that we stimulated the vagus nerve with CRT, or the cranial release technique. That is the point of the story. I'll continue further on down because it's just going to back up what we're talking about here. Number 5, the vagus nerve initiates the body's relaxation response, helping things to chill out. Again, it's the brake pedal, if you will, in the car. The vagus nerve translates between your gut and your brain. Your gut uses the vagus nerve like a walkie-talkie to tell your brain how you're feeling via electrical impulses called action potentials. Your gut feelings are very real. Overstimulation of the vagus nerve is the most common cause of fainting. Electrical stimulation of the vagus nerve reduces inflammation and may inhibit it altogether. So here's the cranial release vagus nerve connection. Neurosurgeon Kevin Tracy was the first to show that stimulating the vagus nerve can significantly reduce inflammation. So stimulating the vagus nerve reduces inflammation. That's a great thing. Results were so successful, he reproduced the experiment in humans with stunning results. The creation of implants to stimulate the vagus nerve via electronic implants showed a drastic reduction and even remission in rheumatoid arthritis, which has no known cure and is often treated with the toxic drugs, hemorrhagic shock, and other equally serious inflammatory syndromes. So if you can do something that will stimulate the vagus nerve, which has overall systemic effects to help the body, and one way to do it is to put in this electrical stimulation device that this neurosurgeon created. But in my experience, another way, an all-natural, surgical-free way, is with the cranial release technique. So we'll keep that in the back of our hat for a moment. And now number 9, the final one in this article. Vagus nerve stimulation has created a new field of medicine. Spurred on by the success of the vagal nerve stimulation to treat inflammation and epilepsy, a burgeoning field of medical study known as bioelectronics may be the future of medicine, using implants that deliver electric impulses to various body parts. Scientists and doctors hope to treat illness with fewer medications and fewer side effects. So, all sounds good to me. I would say before you went in for the electric and the surgical implant, why not try something simple? That's the cranial release technique. So let's just flip slides for a moment. And here's really the map of the vagus nerve. It exits from the brain. It stimulates the throat, the pharyngeal and the laryngeal branches here. It goes down to the lungs, to the heart, to the liver, to all the digestive system, to the kidneys, to the spleen. And again, proper vagal nerve stimulation enhances overall function. And that's what cranial release is all about. It's restoring normal function. Normal sympathetic and parasympathetic function. Again, this is Dr. Doreste with the cranial release technique. I will link that article in the description. For more information, you can visit the website. That's cranialrelease.com. If you're a practitioner and you would like to learn how to learn the cranial release technique so that you can affect positively the vagus nerve, click on online training button on the cranial release website at cranialrelease.com. Again, this is Dr. Doreste with the cranial release technique. Thank you so much for watching this short video. Have a wonderful day and adios, my friends.